To go. Um, we are delighted to welcome to the program this week, which, as you know, takes 30 minutes. We try to keep everything down to 30 minutes. One of our favourite pharmacists, Jimmy Desai, Gemini Desai from London, from Essex, in fact. He's going to talk to us about the role of pharmacists in diabetes. What exactly are pharmacists expected to do? What is their current role? How do they fulfill that role? And what is the intention of the government in respect of a further role of these pharmacists? We all know our local pharmacists, they're very important to us, and therefore what they do, how they help us with our prescriptions and with diabetes is going to be of great importance. So he's going to talk to us as usual for 10 minutes, and then we're going to have a few questions to him. A big welcome to Jimmy Desai from Essex in London, and he's going to talk to us about his practice and what they do for diabetics. Good evening, Jimmy. The floor is yours for 10 minutes.
Good evening, Keith. Good evening, all. Thank you for having me on the program. As we know, diabetes has been a condition which has gone from bad to worse, not only regarding the symptoms, but also the treatment. The amount of funds put in, effort put in physically, and also the people go through wrong myths over the last 50, 60 years to improve diabetes. In that case, the primary care team, as it's now called, which includes us as well, along with the GPs, nurses, and the consultants, have put in a 10-year plan. Last week, we had the plan renamed as the Darcy Review, which puts us in a position to go through the clinical pathway and treat diabetes. Gone are the days of the pills and portions where people used to die in the first 10, 12 years, die premature, diseased. But now we help them treat diabetes in such a way that other organs do not fail. There is less complications involved because we spend a lot of time, effort, and resources doing screenings. The screening means we have these free events where I've been with some run by Silver Star as well. And that's where we bring awareness. Awareness brings questions. Questions lead to answers. And answers then lead to an effort to use that treatment. Because some people still believe this will never happen to me. Now, those days are gone, and the patients have taken this disease quite seriously. On the other hand, the efforts we put in as pharmacists, along with our other role of dispensing, advising, and running the businesses and services, the government has tried their best to help us. There are issues we have because running the services and screening and all does take money and a lot of time. The time for which government cannot give us under the present National Health Service crisis, we still go on. We still have the same role. We still have the same time we put in. The help we get from the pharma companies, the pharma giants like Novo Nordisk and others, they give us enough resources and training online to keep us up to date with their products. We've also got products which are now linked to diabetes improvement through weight loss. Everybody must have heard about the new weight loss injections, the magic injections, they say. Things like Wegovy, Ozempic, Saxenda, and Munjaro. Now, these are the ones which they say bring a lot of reduction to the weight of the patient, which indirectly will help the patient improve their readings. Some companies like Abbott's Limited have now got a pin-free instrument, which is called Liber 2. It's a sensor which you attach to your body, and without the need of pricking your finger, you can have the blood readings on the mobile 24 hours, and you can treat yourself or you can judge which way you're going. So gone are the days where you need to prick your finger, cry, scream, painful nerve endings, and these things do help. I've just been updated last week that Abbott has started another one called LeGo 2. That's again a sensor. So, saying so, a lot has been done by pharma companies, and we pharmacists do assist these companies in explaining to the patient the importance of using such gadgets, following the right guidelines, alongside the free advice we've always given of exercise, good health, good eating, mental stability, etc. The government has appreciated us, but they have failed to assist more as form of a financial reward. We do understand that the crisis is spreading. Hopefully, in the new term, we might see some more resources whereby the patients would get more of these electrodes like Liber2 and LeGo2, where finger pricking and screaming, shouting is reduced. Now, that was one of the factors which actually was not accepted by some patients. So they never tested themselves and they waited for the hospitals to do it once every 6 months or so. The result was that the doses were not the correct ones, and it was showing a high increase of the sugar levels in them, which in fact made it worse because the other organs were affected. And unfortunately, for some patients, it led to renal failures, amputation, etc. We have tried our best. It's like taking a horse to drink water. But patients, I must say, recently have been very careful, cautious, because there is a lot been in the social media regarding these diabetic treatments. Awareness, again, is important because we run through quite a few of these events free of charge. We've been to social events and explained the importance during festivals, especially where I am in East London. I am invited every year once to speak in the local mosque about diabetes treatment and what to do and what not to do. So that helps them gets rid of the old myths and keeps the treatment going, which eventually will save lives. I suppose that is all what we are here for, because complications do arise with diabetes. And it's not only the sugar which is affected, it affects your heart, affects your kidneys, affects your eyes, affects your brain, and it affects your feet, the nerve endings. So the team, primary care team, which involves GPs, nurses, pharmacists, podiatrists, and opticians as well, we all play a part in treatment of diabetes. I can say Britain is doing really well in the field of treatment of diabetes. But then there is always a room for improvement. At present, although the 10-year plan involves diabetes as number 2 after CVS, means cardiovascular symptoms, we still feel that if more resources were put in financially by the government, we could do a lot. We could spread better instruments out, or we could help these companies which are struggling as well. For instance, a lot of people would be assisted if you use one of the electrodes, like the Libers and sensors. It's very easy, but then they're not cost effective. So if in any way the government would fund these, a lot of people would have a real and steady numbers going through, which will reduce the need of increasing the tablets they're taking or injections or whatever. The other thing we found is since the primary care has taken up in the last 10 years, it's a link. All the team members are in together. Many a times you realize if you go to a dentist, you would be asked a question, do you take diabetic tablets? Now, you would have wondered, why would a dentist ask you that question? Because he or she would then assume or rightly announce that there is an effect on your gums or whatever. So all of us, we try and help whatever we can. And we're still doing it. We are trying to upgrade our knowledges. We are trying to read support the systems, do a lot of online studies, and it actually helps the patient end of the day, which is got to be our goal.
Oh, thank you, Jimmy. Thank you very much for that. I didn't know you'd come to an end.
Oh, I could go on, but I don't know. I mean, I wasn't sure of the timing.
Don't go on, because I'm sure there are lots of questions. I'd like to start with a couple of questions, and that is this idea that I think Rishi Sunak had when he was Prime Minister. He made an announcement, but as with so many things, announcements are made, but they don't actually happen because we then had the election. Why is it that the pharmacists can't do testing for people, as Silver Star does? Obviously, we do it for free when we have our camps and we have our meetings. And now that the office has been refurbished, we're going to have weekly testing for free at the office there. Why can't you do this? Is it to do with funding at the moment? Does the doctor get paid? Because sometimes when they come to the Mela, for example, and their blood sugars are high, Rajiv and the team will tell them, you must go and see your GP on Monday. Do they get paid for doing that test? And is it possible to give you all the funding to do it, which means you are then in a better position to see patients? The difficulty we still have is getting appointments to see doctors. And if you ring up a doctor's surgery and you say, I want to come because I want a diabetes test, they'll probably think it's a complete waste of time, of the doctor's time. So how do you think we can help to get testing for diabetics moved from GPs into pharmacies?
We've run this screening before. We've run it into pharmacies and all. We were told a couple of years ago that it would be one of the new services, a funded service, as you rightly mentioned, for us to carry on. Look, we don't mind doing it for free. It consumes a lot of time. We've got to do other things which earn us a living. So the government, although who said that they will fund the services, never did. Because running such scheme will require staff which are trained. We have to do the jobs, and plus it requires the material, the strips and all, the machines and all. Time was an important thing. So if you have to run it screening, I'm sure they need to pay us. On the other hand, as far as I know, the GPs actually get Browning points, which years ago you could turn it into cash or whatever sometimes. Now what I've been told, it's a global sum. And that is why, if you ask for an appointment to get a blood test done, they will either send you away to a clinic which does full blood, where you give full blood, or they'll give you a machine which has been given to them by the company, and you do your home testing kits. That is one of the reasons. So if they want us to do the services like what we've done, the 7 services we do as Pharmacy First, or the new services they say we might be doing is the lipid management, cholesterol testing. Now, if that is put into consideration, I'm sure we can tell them to push into diabetes first. Because once you're diabetic, your cholesterol testing is required as well.
Okay, I'm opening it up. Anyone has a question, they can either speak out, put your hand up, or put the yellow hand. All of those are absolutely fine in terms of how you join the conversation. In the absence of anyone putting their hands up, I have another quick question about branded versus generic drugs. I noticed that for my pharmacist this week, for a long time, I didn't have Lipitor. I started off with Lipitor for my cholesterol. I mean, I don't know about these brands, but that's what I started with. It then went to generic, and then it went back to Lipitor. Who makes the choice as to what kind of drug you get? Is it going to be the doctor or the pharmacist in terms of brand versus generic?
Well, the honest answer is the government makes the choice, because what we have is we call a drug tariff. The tariff is the book where they show you the money you get every month for every product. Last 5 years, the tariff prices change twice in a month. So we try and go for the brand which they suggest, which is of that price. Secondly, the issue is the stock availability. A lot of stock is not available because of the Brexit reasons. Majority of the NHS drugs come from overseas. They are licensed to be distributed here, but they are manufactured outside. So if there is a company which is within the EU, outside UK, their licensing stops at Dublin, which is the closest we have. If we haven't got a treaty with that company will not allow the drugs to come in. So in that case, the NHS has to look around and find whatever they can get. I'm not saying the standard is not good, but that is how the trend changed. Coming to the point of Lipitor, Pfizer was making Lipitor years ago. It was very heavily priced. When they lost the license, the generic companies took the license of them. Apparently, Pfizer also manufactures cheaper generics, what with the same price. I mean, same name, which is Lipitor and whatever. So that's how sometimes people get one of those.
Okay, thank you very much. Who has a question to our happy local pharmacist, Gemini Patel? Anyone has a question?
I just wanted
Hello.
to ask,
Yeah.
sorry, I just wanted to ask, how many times should either a doctor or a pharmacist should do a blood check for diabetics?
That depends if you're a type 1 or type 2. If you're a type 1, which is insulin dependent, then you have to titrate the dose, in which case the endocrinologist, the consultant, will tell you to take the figures probably sometime once or twice a day, or even after a meal. If you're type 2, the general guidance was to do testing twice a week. And that is why we used to dispense 1 or 2 50 packs of strips, assuming it would last you for whatever days. But now some consultants in the hospitals say even tablet people need to do it twice a day. We find it strange because your dose doesn't change. It gives you an idea what the reading is. But sometimes looking at the readings, which might have gone up in the morning, come down in the evening, you get the wrong impression. But if you're on insulin itself, then yes, you have to titrate against the figures and check how much you need to inject yourself with. But otherwise, for tablets, twice a week should be enough.
And what's the best time if you are type 2 and on medication like metformin, dapagliflozin? Should you do first thing after waking up, or what's the best time to do the test?
Technically, if you wake up in the morning, the glucagon conversion will always show high sugar. So if you take a reading 7 o'clock, it will definitely be higher. You might think that I had something a lot to eat, sugary. That's not the case. Early morning readings are always high. So we say if you want to take 2 readings, you can either take it, say, after breakfast and 1 in the evening, because early morning readings are always high, which is we call a glucagon injection in the blood. That's automatic. The body does.
Thank you very much. Thanks much.
You're welcome.
Thank you. Nazreen Khan, you had a question?
Yes, thank you very much. That was really nice. And I just hope and pray that the 10-year plan is, very beneficial. What I wanted to ask was, actually, Keith has just asked that if we can go to the pharmacist to get the blood test. But my second question is that I am I was diabetic and I've gone to pre-diabetic with my intermittent fasting and with a lot of sort of things on the media read and all that. Good sort of, control my food and what sort of good habits and all that, exercise. Now, I only take 1 metformin a day. Do you think I should still be monitoring my blood test? Or, I mean, I haven't done it for the last 3-4 months because I have to go and buy my own, the monitoring device and all that. So should I just be still monitoring it, or should I just leave it? It's just one metformin I take a day, and I'm sort of like I do intermittent fasting as well. So what do you think I should be doing? Should I still be monitoring?
Well, I mean, when was the last you saw an endocrinologist, a specialist in hospital? Was
It's
it a
been
long time?
ages. It's been
Oh,
ages.
okay. All
Yeah.
right. So they're left to you to monitor
Yes.
and get the reading.
Well, I mean,
I
we
would-
only go. Sorry. We only go to GP once a year for my HbA1c done. That's it, really. Because I went from diabetes to pre-diabetic, so I think maybe they don't want to monitor it too much. I suppose they haven't got the time. I suppose.
No. How it works is when you have an HbA1c done, they usually, if you're a full-fledged diabetic, they do it every 3 to 4 months once. As you said, you had a good control and you went on the other side, you might not need that much of testing. True. Keeping you on that one metformin would be one of the reasons to keep your kidneys safe. Because even though you're good at the reading, there might be still sugar going through the urine to the kidneys. So that is a very traditional way. If I were you, I'd go to the local pharmacy and request them if they can just do one single prick test and see what the reading is in front of you. I would do it if my patient would ask, rather than leaving it for 4 months. You see?
So
We
should my
do it.
pharmacist,
We do it for patients.
right? So should my pharmacist be doing that though?
Well, yes, if as I said, if this is a case, I have got a few patients who are in a similar situation, and I said, look, why don't you come this day and I'll do it for you. And
Wonderful.
we do it free of charge.
Right.
Screening. So they know where they stand.
Right.
We've done our service.
Right.
That's how it's supposed to be, but it all depends on individual pharmacists.
Right.
We used
Thank
to
you
do it
very
in
much.
full-fledged.
Right. Thank you very much. That's
You're
great. That's
welcome.
great news. Yes.
Good.
Thank you. I'll be there tomorrow.
You should be.
Unfortunately, Nazreen, he's in Essex. So until he opens a branch in Leicester,
Oh,
we
right.
will
We are
not
in
be able to
Leicester.
see
We
him.
are in Leicester. We are in Leicester.
But
Far away.
very soon in the new year, Silver Star's office at 201 Uppingham Road, every week on a Wednesday or Thursday, there will
Right.
be screening. So you'll be able to
Wonderful.
have your test there.
Wonderful.
So that'll be
that's-
starting in the new year. We've just been
that's
taking
great.
time to.
That's great. I must say that it's because of Silver Star and the meetings, I controlled my sort of eating and my exercise and everything, and I've gone from diabetes to pre-diabetes.
Oh,
So
wonderful.
that's wonderful. Yes.
Make a note of that, Raji. We must video Nazreen for our next official video.
Honestly.
I'm
Thank
very
you.
jealous of you being on only one metformin. I wish I could go on one metformin instead of
Thank
4.
you.
So do I.
Thank you. Thank you.
Anyone else got a question for Gemini before we part company with him? Anyone else? One final question for me, if that's okay, which is remind us about the relationship between the GP and the pharmacist in terms of the prescription that is filled. I won't say who my GP is, but I've written to him about 4 times saying, please don't prescribe this particular drug, but it's always in my batch because it's still on the prescription. What is the most effective way for the public to get their prescription? What do we have to do to make sure they're ready on time, delivered to us, or we can come and collect them? What's the best way?
Well, under the present system, what we have is all the surgeries have now got pharmacists working within themselves. They are called the medicine management specialist. So every surgery has got pharmacists who overlook, or they can even look into your repeats because that is their section. Gone are the days where the GPs themselves looked into the records and signed off your prescriptions. No, they don't. It's done by the people, the people who are on the prescription. It's called the prescriber's team. So whoever is in the prescriber's team, along the working pharmacist, they control your repeat prescriptions. We assist them by emailing through the NHS mail. We have got restrictions of doing so. The reason is if they disallow certain item on repeat, they will not ring us back or email us back saying we would not allow this to be repeated. So that is where it goes wrong. So if you've been getting 6 items every periodic time, and one of them is stopped, say for example, the testing of the strips is stopped, it would be better if they would come back to us and say, we have disallowed this for such and such reasons. They don't. And they don't even ring the patient. A lot of practice is done. So that's why the patients do get frustrated. So do we. But otherwise, it's still the same. And we are helping a lot after COVID for repeats to be done electronically because we use the NHS mail. We all have the NHS mail IDs. So it does it quicker.
Germany, thank you so much for joining us today from Essex. We are so pleased to have you on. You're our first pharmacist in many weeks, and it's good to hear what you have to say from your point of view. Thank you for joining us. You're welcome to stay for the rest of the program. We have the news headlines of the week, and then we will be signing off. As you know, we try to keep these to 30 minutes because everyone is very busy, especially at this time of the year. Thank you so much. We're really grateful.
Thank you for having me, Keith.
Presentation.
Cheers.
Thank you.
Next week, by the way, everybody, we have someone to talk to us about diet, because the last dietitian we had was very welcome, and a lot of people wanted to hear from another dietitian. So the dietitian will be coming on next week. We've got, in partnership with Silver Star India, 2 camps coming up, but you'll have to travel to Kerala for the first if you want to go to that camp. Nazreen, if you want to be tested, and you can fly to Kerala, there will be a camp in a place called Thrissur in Kerala on the 20th of December. And we are hoping to do a second camp with Silver Star India round about the time of Pongal in Tamil Nadu, in Chennai. So 2 international camps, because obviously it's very cold now and the mobile diabetes unit does not go out in the winter because people are too cold to go and get tested. Let's go for our news headlines. Rajiv has the news headlines this week. Rajiv, what are the top stories for diabetics?
News headlines of the week. Nutrition expert warns against fast weight loss diet as it can cause diabetes. A nutrition expert has issued a stark warning over a popular diet plan that could be putting people's health at serious risk, suggesting it might trigger a severe ailment. The weight loss strategy in question is dubbed the carnivore diet, which sees its followers forsake plants, instead gorging solely on animal fare like meat, fish, egg, and select dairy, also mixing fruits, veggies, grains, legumes, seeds, and nuts in what termed as the zero-carb regime. Next headline, new treatment to transform type 1 diabetes care. A newly designed therapy following an islet cell transplant could mean people with type 1 diabetes no longer need to inject insulin, a new study has unveiled. The islet cell transplantation involves extracting islet cells from the pancreas of a deceased donor and implanting them in the liver of someone with type 1 diabetes. The infused cells lodge into those small blood vessels and start producing insulin. According to data from the trial, the first 2 participants are now insulin independent and have standard HbA1c levels, while the third reduced their insulin use by roughly 60% 3 days after the islet cell transplant. Next headline, diabetes symptoms can show up first thing in the morning, warns pharmacist. Pharmacist says if you have increased thirst or severe hunger or feel the need to pee frequently, it might be a symptom of diabetes. The body's blood sugar levels are naturally high when we wake up, and it is generally recommended that to eat between 1 to 1.5 hours after waking. Thank you.
Wonderful. Thank you very much, Rajiv, for those news headlines. As I reminded you, next week we have a dietitian coming on, and the week after we have a podiatrist. We must not forget our feet and toes. They are very important to us diabetics. As I said, by the beginning of next year, round about the 20th of January, we'll be starting free testing, which will take place at 201 Uppingham Road. It'll be open every week at a certain time so people can go in and get tested. In the meantime, a big thank you to all of you. I don't know whether Dr. Hina got on. She was looking for the link. She should have got it because we've sent it several times. If not, we'll see her next week. Thank you all for joining us, and thank you to our pharmacist, Germany Patel, for joining us. We'll see you all at the same time next week. Good evening, everyone.